We're joined via Skype right now by the wonderful Dr. Amy Kenzer. Amy, are you there?
I'm here.
Wonderful. So great to see you today. Amy, tell the folks at home what your title is, what you do.
Well, I am a research and development manager, so I spend most of my time working on projects within CARD that look at trying to maximize our treatment interventions for kids to make them as effective and efficient as possible and make sure that we stay up to date on all the current research that's out there.
Wonderful. And you know, effective and efficient, we talk about that all the time here because that's what we want to be as a parent. We want to be as effective and as efficient as possible. So I asked you to come today to talk specifically about toileting because we've had a lot of questions lately about toileting, and I thought it would be a wonderful opportunity to get some information out there. So if you would talk to us a little bit about what are some of the things that we do before working on toileting. For instance, how do we know when to start working on toileting?
Right. Well, if you look at typical child development, awareness and the ability to kind of start toileting emerges around 2 years of age. And most kids, 98% of kids who are typically developing would be fully toilet trained by the age of 4. So you're looking at kind of a 2-year time frame that toileting typically happens. But we also know that kids with autism, about 50 to 70% have difficulty acquiring this skill. So we're looking at this age range when it tends to become easier to start to toilet, but it doesn't mean that it always happens within that time. Sometimes we have kids who are a little bit older when we're starting to toilet.
Okay, so we shouldn't be panicked if 4 has come and gone and we're not there yet, because can we, if let's say a child is 8 and has not yet successfully gotten toileting, is that too late? Is there ever a time that it's too late?
No, there's never a time that it's too late. And actually, I've had personal experience with teaching even adults who had been dependent on using, diapers or, incontinence underwear, and they've learned how to toilet as adults. So there's never really any, age that's too old to learn how to toilet.
Okay, great. Well, that's a great thing for us all to hear. But if we say that we're going to work on toileting, I'm sure that there are some things that we need to have in place before we actually get working. Are there prerequisites for somebody before we work on toileting?
Yeah, there are a couple of prerequisites. And then this doesn't mean that if your child isn't able to do these things, that they still can't gain more independence and start using the toilet. It just means if they have these skills, then they're going to be able to toilet even more independently without as much assistance from you.
Okay.
So ideally, your child would have the basic skills of dressing and undressing, being able to kind of pull their pants down and then pull their pants back up. After they've used the toilet. So that's kind of the real basic piece there. They need to be able to get onto the toilet. So some of our little guys, you might need to put a step stool in there. You might need to put one of those little cushy seats that sits right on top of the toilet seat in there as well, so that it kind of fits their size to make it easier for them to be able to climb up and climb down independently. And then the other thing you want to look for is them staying dry for an hour and a half to 2 hours at a time, or thinking about going, having to change the diaper, 10 times per day or less.
Okay.
You want them to be able to kind of hold that urination in for them to be successful at toileting.
Okay, interesting. And so it brings up, I know that you guys always like to take data.
Yes.
So if we're a parent and we're getting ready to toilet, we need to start keeping track of some stuff, right? We want to keep track of, you were saying, an hour and a half to 2 hours that they're going, that they can be dry. What other kinds of things would it be good for us to keep track of before we start toileting?
You also, if you're thinking about toileting, because a lot of times when we think about toileting, we focus on urinating in the toilet because it happens much more frequently throughout the day. But if you're also planning, and hopefully you are, to work on teaching defecating in the toilet, then you want to start taking some data several days in advance to find out when your child's most likely to do that. Is there a time of day when they tend to do that? Is there a location that they go to? Are there other kind of indicators? Do they hide behind the chair? Do they kind of squat down? Do they, get into a particular position? It's very common for kids to do that, to kind of indicate that they're going.
Yeah.
And taking data on that so you know what those are before you start trying to catch it and getting your child to the toilet.
Yeah. We call it a poop schedule in our house.
Yes.
The poop schedule. That taking a look at, and it may be that you already know that as a parent, but it may be that it just hasn't occurred to you because your day has been busy dealing with a bunch of other things, but really, as you were saying, beneficial to know. And then when I hear lots of different people talking about how they want to approach toileting, and there are some people who say, we're gonna go slowly, and other people will say, no, we're gonna set aside a weekend and we're gonna hit it hard. What do you recommend, Dr. Kenzer?
I recommend having the weekend and hitting it hard and having what's called a potty party. Because the point is to make it really fun for your child, so that sitting on the toilet isn't something, like, oh man, I have to do this again, but something that they kind of look forward to, that's fun. That they'll enjoy that time and also have a lot of practice opportunities in a really short amount of time. And that goes for not just toileting, but a lot of things that we're teaching our kids. If we have a lot of practice opportunities in a short amount of time, then they're going to learn it faster.
Yeah.
So if it takes 10 tries for your child to learn it, and you do 1 try per day, it's going to take you 10 days at the minimum. If it takes 10 tries and you do it 10 times in an hour, then they've learned in 1 hour. So kind of taking that perspective with toileting.
Okay. And we also, my son had, by the time we got to toileting, and he had just turned 3, but he found the bathroom aversive. So we had to go through a little bit of a precursor to where we just made the bathroom an exciting place. It took about maybe 4 to 5 days beforehand, where every once in a while somebody would just yell potty and we would run into the bathroom and everybody would be dancing and singing as we went to the bathroom. And he thought that going to the potty was a party. Is that something that we want to do with all kids, or just if it's aversive, or just in individual cases with kids?
We want to do that with all kids. Before you start and you kind of put that expectation, like, okay, now you're going to have to come in here and do something different that you really don't know how to do, is make it fun. And if you have a child where the bathroom already is aversive, like you said, it might take a little bit longer. It might take a couple of days and really spending some time in the bathroom. Bring in a portable DVD player, bring in some games, play some music, have books, make it fun, dance around, and you might, if your child doesn't find it aversive, you might just be able to do that for a day or for a little while before you start trying to get them to go on the potty, but make it a fun place.
Yeah, absolutely. Okay, we're going to take a little bit of a break, and when we come back, we're going to talk about, we're going to take it right down to the studs, as they say, about how we target urination in the toilet. So, if you guys have questions right now for Dr. Kenzer, this is a great time for you to send your questions in, but that's what we're going to do when we come back, so stick with us. Back in a few minutes. Welcome back to Autism Live. Our special guest right now is Dr. Amy Kenzer. She's joining us to talk about toileting. Before the break, we talked about some things to get ready for toileting so that you're prepared. Because I think, I don't know, Dr. Kenzer, I think it's as much about the parents being prepared as it is about the child being prepared. Am I right?
Absolutely. It's as much preparation and commitment. You have to be ready to kind of make that commitment and know that there are going to be accidents at first, and be ready to kind of deal with those and commit to doing it for it to be successful. And
I love when people say, oh, well, we're doing toileting, and they'll say, and we put aside the weekend for it, but next Wednesday we're flying out of town and going on vacation for 2 weeks. And I always think, okay, maybe the planning phase didn't get to the parenting brain. I'm guilty of the same thing. But we want to clear some time. We were talking about the weekend, but you got to have a little bit of time beyond the weekend. It's perhaps not the best week to fly away to Cancun.
Right, or know that if you are going to fly away, be prepared to still keep your child in underwear and take them to the bathroom on the airplane and do everything that you need to do in order for them to continue to be successful with toileting.
Yeah. And 7 changes of clothes in case of.
Yes.
But okay, let's assume that we've cleared our schedules for a while. We've done our prep work. The bathroom is a pleasant place for the child to be now. It's not aversive. And we're ready to start working. Do we want to work on urinating and defecation, pooping in the potty at the same time, or do we want to separate them out a little bit?
It's probably easier to focus on urinating first.
Okay.
Just because you're going to have a lot more opportunities to be able to, teach your child what to do with that. But doesn't mean that if you don't, if you catch your child starting to have a bowel movement that you can't, bring them into the bathroom.
Okay.
It just means it's going to be easier if you focus on urinating and then take those skills and try to generalize them to the bowel movements.
Okay, great. So we're ready. It's the start of the weekend. What kinds of things do we want to do to get that success?
Step number 1, throw the diapers away.
Okay.
Step number 2.
So we're not doing the pull-ups then. We're totally.
No.
Okay. Diapers
No,
gone.
we're not doing the pull-ups. We want to go straight to underwear because that's what we want our kids to be wearing is underwear. And we want that real sensation of if I have an accident and I go in my underwear, it's still nice and wet and uncomfortable versus if I go in a pull-up, it's pretty much like a diaper. And it's hard for our kids to know the difference.
Right. And I think there's something really reinforcing sometimes for some kids about the underwear, especially if you get the character underwear and help them pick it out. And it can be really reinforcing in and of itself. Not for all kids, but some kids. Okay, so we've tossed away the diapers. We're feeling that heady sense of I'm not spending any more money on this. And we put on the big kid underwear, and now what?
And you have some really big reinforcers that your child is motivated for because, again, this is something that's hard for them. It's a challenge. So you should be prepared to have that party when they do go on the potty. Okay. So praise and big reinforcers and fun stuff. And then you go in the bathroom and you have them sit down on the potty. And you're going to start with them on the potty for an extended amount of time. You're going to do 20 to 30 minutes sitting on the potty. Okay. Now, if during that time they pee, then you have a party and they get off and they get to play for 5 to 10 minutes. Okay. After that time, if they still haven't gone, then you're still going to let them off the potty, let them stretch, let them move around. It's not that comfortable to sit there, for a long time. So kind of let them get up and move and play a little bit. And then after 5 to 10 minutes, back on the potty and trying again until they go. And it's also really important that there's a lot of motivation to go. So we have the reinforcers, but we also have a lot of liquids. So get their favorite drinks, get them salty snacks, and have them eating those salty snacks and drinking those drinks while they're sitting on the potty and hanging out in there so that they actually have, to go.
Okay. So, what a question I didn't ask before. Do you advocate the little toy potties or the big potty? Which one do you prefer? Or does it not matter?
There's some amount of personal preference, what you want to do in your own home and the size of your child. If you have a really little guy, it might be more comfortable for those, little potties. But I would recommend using the cushy seat on the regular toilet. Okay. For a couple of reasons. One, because then you don't have to then teach your child again, here's the new toilet that you should sit on instead of this other one. And 2, it's a heck of a lot easier to clean up. Yeah,
that's true. That's absolutely true. Because you flush and you're done.
Yes, and you're done.
Yes, instead of having to take it and rinse it out and doing all of that.
Yeah, dump it, flush, rinse, clean, all that. Yes. So it can be harder.
Okay, so I'm really fascinated though because we're putting the child on the potty for 20 to 30 minutes, and we need to keep it reinforcing while they're there, right? So whatever that takes, and it's going to be different for different children.
Right. So something entertaining that they can do. If they like puzzles, bring in a puzzle. Look at books, listen to music, watch a movie. But make sure that when they do actually urinate in the toilet, that it's even more fun. Yeah. So they get to get off and they get to play with something. Maybe they get a special toy that they get to play with. Maybe they get, a special treat or snack. And they're getting all the praise from you, and it should just be literally you're throwing a party for them at that point.
Yeah, literally, we call it the potty party.
Potty party.
Yes. Absolutely. And I don't know if you do this for everybody or whether it was just for me, but as a parent, there was a timer, and it was for me and my husband. And we were given specific steps of, that you set it for this amount of time, and that's how long the child stays on the potty. If they go, the timer, everything is off. But if they haven't gone and the timer goes off, that's when you get them off and you reset it for this exact amount of time.
Yes.
And then back to the potty for this amount of time. So there was no guesswork for us, and the timer went off, and we were my husband and I were the little Pavlovian dogs, because the timer went off and we did things you know what? That was the part for me. I was saying this to you during the break, that I felt like that was the errorless learning for me, the parent, because I get caught up in things, and I would have been having a conversation saying, oh, we could just wait another second. But that timer was the strict beginning and end of whatever phase we were in.
Right.
And I honestly think that that's what got us potty trained that quick, because it forced our consequences to be really specific for me. So do you do that for everybody, or is it just for parents who don't do well with time management?
I think it's helpful for everybody to use the timer, because you're right. It keeps you on track. It tells you what you should be doing when. And it also helps our kids, because then it's not some arbitrary, get back on the toilet time that mom or dad is implementing, but the timer beeps. It's really clear. Now I get back on the toilet, or the timer beeps and I get off. And it makes it a lot easier. But the timer too, that first day you spend almost entirely in the bathroom. As you have your child be successful, so you have 3 successful urinations in the toilet, you start to increase the amount of time that they're off the toilet, and reduce the amount of time that they're sitting on the toilet. And your goal is to end up so that they go and they sit on the toilet for 2 or 3 minutes, and then they're off for 30 minutes, and they're not having accidents in between those visits. And the timer is really helpful, because once they spend more time off the toilet, it's easier for us as parents to get distracted and into doing other things and forget to take them back to the toilet. So the timer says, oh, time to go potty. We go back in there.
Yeah. And I think it's so ideal to be working with somebody else to help you set the timer things, because I wouldn't have known what to set it to. But I know that there was a big period of time where I was saying this the other day, that we would go 20 minutes. The timer was always set for 20 minutes. It would go off and everybody would go potty time. And we would go off to the bathroom, and he would be on the toilet for 5 minutes. If he didn't go, then he was off the toilet for 5 minutes, then on for 5 minutes, off until he went. But very quickly, we would go potty, we would go in, and he would go potty. We'd do the yay, you went potty, and do the potty dance, and he would get something that was really reinforcing to him, and we would go back and reset it for 20 minutes. And that became, and the timer went with us when we were out. It went everywhere. And he potty trained like that. Was crazy good. So, but I wouldn't have known how to determine those different minutes. So hopefully everybody's got somebody who's helping them design the program. But what kinds of things determine how long, and how fast do you change the time? How fast do you go from being 20, 30 minutes? Like, is it by 1 minute increments, or hard to say because you have to judge by the child?
You kind of have to judge by the child, but you can kind of go generally based on like a 5-minute increment. So, decreasing the sit time by 5 minutes. So going from 30 to 25 to 20 to 15 until you're down to 5. And what you're hoping for is that by the end of the day, or sometimes 2 days, if you have a weekend potty party, is your goal is that your child's sitting for 5 minutes, playing for 30 minutes in between, and that if you take them potty and they have to go, they actually go within the first minute of sitting down. And if they've gone, then you're kind of like you're in the safe zone. Usually you have a little bit more time before they're going to go again. Then if they haven't gone, then you might want to, like you said, jump back on after 5 minutes just to try to catch that time when they will need to go.
Yeah, but it's amazing that very quickly they get into a rhythm and they go. It's, you say you might keep them on for a maximum of 25 minutes, but most of the time you're not, because they'll go within the first few minutes, and that happens pretty quickly. So Anything that we need to be aware of, like if we see that it's not happening, what kinds of things can we help ourselves? More drinks, more salty snacks?
Yes, really load them up on drinks, encourage the drinking as much as possible. If you have a really good drink that they like, usually that's easy, but if, they kind of get where they don't want to drink anymore, that's where the salty snacks come in. So
Yes.
their mouth gets dry and then they want to drink, and we keep going through this to keep them very well hydrated throughout the entire process.
Yeah. Which is actually a good thing for them to be well hydrated.
Yes.
And it does make it more likely for us to have the success. Okay, great. We're going to take a break, and then we're going to come back and talk about the poop in the potty. It's the thing that it seems to be much harder for everybody, and it takes a little bit more time and a little bit more patience. So we're going to talk about that with Dr. Kenzer. If you've got questions, now's a great time to write in and ask. Of course, if you're watching this, a taped version, you can still ask your questions via email. We'll give that to you when we come back, the email address, because we know where Dr. Kenzer works and we can get in touch with her if you have questions later on. Stick with us. Back in a minute. Welcome back to Autism Live. We're webcasting to you live from the Center for Autism and Related Disorders headquarters in Tarzana, California. And our special guest right now is Dr. Amy Kenzer. She's been joining us, talking to us about toileting. We talked about how to get ourselves ready, how to know when to start toileting, how to take on urinating in the potty. And now we're going to do the big pooping in the potty. If if these kinds of conversations are not for you, then this is not the segment to watch, right? But for those of us,
Right.
it's a real part of our lives. Having our child be able to poop in the potty, it's one of those things. I think it's a big self-esteem boost for the parents and an even bigger one for the children. When they get it, they tend to be really excited about it, but it's not the easiest thing in the world to teach, right, Dr. Kenzer?
Right. Well, it's harder because you just don't have as many opportunities. It's normal for a child to only have one bowel movement a day or one bowel movement in a couple of days. And so that limits your opportunities to kind of work on it.
Okay, and it literally takes longer, so you can be feeding a child. When you give a child lots of drinks, it's not going to take that long to work its way through. Where you give them a lot of food, and it's going to different speeds. So you mentioned before to kind of keep track of before you start, to have an idea of when does your child poop, what do they do, what kind of behaviors do they engage in when they do poop. So if you have an idea of when they poop and what kinds of things that they do right before they poop, what can you do with this now that you're ready to go for the poop in the potty?
Right. Well, now that you're ready to do that, you've already been practicing urinating. So that kind of process of sitting on the potty for a while, making it fun, and then taking breaks or, getting off and providing a party when they do go, you're going to use those same strategies for defecating in the toilet, but you're not going to spend all day there because they're not going to go many times in a day. Instead, you're going to try to pick those times you've identified as really likely for them to need to go and start then. So if you know that they always go, within the half hour before bedtime, then you're going to start sitting on the potty during that time to try to capture it. And just like we said, salty foods and have drinks for urinating, there are some things we can do to make it easier and more predictable for defecating. So you give them a lot of high fiber foods. The liquids are going to help move it through the system better as well. If you think your child has difficulty having a bowel movement, if your child's constipated, you definitely want to talk to the pediatrician before you start trying to work on toileting, because you want to make sure that you make that as easy as possible for your child. And your pediatrician might recommend a stool softener or something else that can help them be more regular and make it more comfortable when they go.
Although the water also will help with that too. Yes, that when you're doing all the urination training and you're applying them with water, sometimes that kind of makes the whole thing function a little bit better. So, but important to be able, if you are having issues, and I would imagine it's the other way too, that if you're having loose stools, might be something to look at with a doctor as well.
Exactly. And before you start trying to train, to go on the potty so that they have better control, and it's not as aversive for them to go on the toilet too.
And I feel like with the first one, it's a little bit, it seems like it's hit and miss, and it's about being vigilant, trying to catch it so that you can give the reinforcement for the first one.
Yes, and then making sure your reinforcement is very powerful so that your child's motivated to do it again.
Yeah, and I think so important that as parents that we not only have the reinforcement in mind, but that it's there physically so that we can give it immediately.
Yes.
That was something that we were talking about the other day, that, if you have to go buy something and have it there in advance, that's not the time to go to the store and be hunting for the thing at 2:00 in the morning.
Right.
To have it right there so that you can give it immediately.
Right.
Dr. Tarbox was saying the other day that for some kids that saying, if you go if you go poop in the potty, we will go for an ice cream cone at McDonald's right now. But he was saying how important it is to make sure that that you know that the McDonald's is open and that the child poops in the potty, and you have your car keys in hand and you leave right then. Because as parents, sometimes we're like, well, we'll go in 5 minutes. It's not going to reinforce it.
Right.
Okay.
Right.
So what else do we need to know for pooping in the potty? It's basically the same kind of thing, or is there anything else that we need to know for the pooping in the potty?
Well, the comfort on the toilet becomes much more of an issue for pooping on the potty. Okay. So that step stool where they can put their feet on it does really become important, because if you think about the difference between urinating and pooping on the potty, with urinating, they simply need to relax. With pooping on the potty, sometimes they need to kind of, push. Right. And that's going to be hard to do if they're holding themselves up on the toilet to keep from falling in, because now their body's not relaxed. And if their feet are dangling and they don't kind of have anything solid to put them on. So we want them to be really comfortable, have that potty seat that fits their bottom so they can relax, and something to put their feet on. And it can help too to give them those reminders and model for them, like pushing, that pressure on their tummy, leaning forward, all of those different physical prompts to help make it easier for them to go. Okay,
what about the kids that for whatever reason they're peeing in the potty, but they're nervous about pooping in the potty because there's a splash, or we see some kids that it's like they feel like they're losing a part of themselves. What kinds of things do we do to help them to know that it's not that there's nothing aversive about pooping in the potty, that it's really a relief, or do we just try to make it so overwhelming that we catch it?
We try to make it really, really fun, again, to be in the potty.
Okay.
Sometimes if you have a kid who is really struggling with this, we might start with, and they're asking for the pull-up, or they're wanting their diaper back on so they can go, is sometimes if we're not kind of able to get success without the diaper, is we will do, diaper on sitting on the toilet.
Okay.
And kind of get that relationship between I go poop on the toilet, and then we can slowly remove the diaper, or, I've done in the past where we've cut holes in the pull-up so that they still have that comfort of it feeling like it's on, but it's actually going into the toilet.
Very interesting.
And that can be really helpful too. And the key is eventually getting all of that diaper or pull-up off, and they're going on the potty. Wow. That's not as common to have to do that, but, it helps sometimes.
Okay. So now let's take a second to talk about nighttime. And what happens with potty training with both of these things, with peeing and with poop at nighttime? I mentioned to you during the break that I hate to admit this because people hate me when I do, but I did not have this problem with my child. He came out of the womb and did not want to do anything while he was asleep. I don't know why. I got incredibly lucky. So I honestly don't know, and I hear parents talk all the time about this. It's just the hardest thing in the world. So what can you tell them to help them?
Well, first, just a reminder that with physical development, regular physical development, is that the nighttime continence follows behind the daytime continence. So, it's not uncommon for your child to be successful during the day and still have accidents at night. So initially, you might still be putting the diaper or the pull-up on only at nighttime. Okay. But once you start to get some times where they're dry during the night, or you think they're old enough and ready to move forward with, toileting during the night, one is real easy. Make sure you limit the drinks before bedtime. So just like before we were saying load them up on drinks, now we're saying stop 2 hours before bedtime, limit that drink. 2, make sure they go right before they go to bed. They use the toilet and they pee. And then once they're in bed, if they, again, if they wake up in the morning and they're dry, big party.
Yeah.
If your child tends to have accidents during the night, it can be really helpful to set your alarm. I know this doesn't sound fun for parents. But
it's a lot more fun than doing the sheets, Amy. It's a lot more fun than having to do laundry.
Yes, it is. I totally agree. Because if they have the accident, you're still probably getting up at night.
Exactly.
So set your alarm, catch your child in the middle of the night, take them to the bathroom, have them go, and then put them back in bed.
Okay.
And again, you're trying to keep, it to a minimum. You're not talking to them. You're not, waking them up, keeping them pretty, sleepy, but going into the bathroom, using the toilet, and getting back in bed. And if you do that on a regular basis, you set your alarm for the same time each night, that kind of helps your child. They will learn to kind of wake during that time and go to the bathroom.
Yeah, that's great. And, I hear this from some parents that it becomes such an issue that there are some kids, and then they get older and still haven't gotten the toilet training, that they're reaching into the diaper and taking the poop at night, and not only just pooping in the diaper, but they're smearing. What kinds of things can you tell us for that? Because that's not fun.
No, that's no fun. I think it's the same kind of strategies is if that happens during the night, it makes for a couple of nights where you don't sleep so much. So hopefully you plan accordingly and take some time to sleep during the day. But again, trying to figure out when that tends to happen. Does it happen early in the night? Does it happen in the middle of the night? Or does it happen near the morning? And trying to capture the time that they go and catch them and have them go to the potty. Is if you can get them and they can go in the potty, then you prevent that, kind of play altogether.
Right, because there's something that's reinforcing about that, and if we make pooping in the potty more reinforcing, we can hopefully turn that around, as it were.
Yeah, absolutely.
Wow. Are there any pitfalls in particular across all of the different things that we've talked about that parents should be aware of and know so that that they don't have a problem later on with toileting?
Right. Well, I think the number one thing is to get rid of those diapers.
Okay.
It's really going to make it more difficult for your child and for you in the long run with more accidents if you switch between diapers. If you think, we're going to go out, to Little Gym now, and so I'm going to put him in a pull-up because I don't want him to have an accident when he's out there playing. Right. Or we're going to go to the park and there's not a bathroom there, so I'm going to put him in a diaper. Yeah. That can really set your child back and make it much more difficult, and you'll have more accidents in the long run. You just have to be prepared to clean it up. So I've been there with my own daughter in Wendy's in the booth, and there's just pee everywhere. Yeah. And people are pretty understanding. Clean it up. They'll come and spray it down, and you change the clothes and move on. And you'll have some of those. Some of those will happen. It's inevitable. But in the long run, your child will learn how to toilet much more quickly. Okay. And then tell me, and because I know you got to go, but tell me just a little bit in terms of generalization, because one of the things that we hear a lot is that people say, my child toileted and they're able to do it at home, but we can't do it at school, and we can't do it at the park, and we can't do it at the store. When do we want to start having them poop and pee in other toilets? How far into toilet training do we want to start to do that to send the message that we do this in other places, not just at home? Right. I would start that pretty quickly. So that first day, your potty party, you're going to probably pick a bathroom that has space and is fun and convenient, and you can stay in there, and that's fine. But you want to make sure that after that first day, when you've got more time out of the bathroom, when you take them potty, you go to the different potties in the house so they can go on all the potties in the house. If you have cousins or aunts or grandparents' house, head over there, spend some time, let them know you're practicing potty, use those bathrooms. Out in public, going in the bathroom and checking them out, even if they don't need to go or it's not time for them to go, just going in there and, again, making it fun, too. Yeah. Have a little potty dance in the bathroom at Target before he ever needs to go in there to use the toilet can help as well. But pretty early on, you want to start using a variety of toilets.
Okay, very good. We had a little song that we would do too that he enjoyed. I shouldn't share this. My son is not going to be happy when he's 18. But
No, he's not.
We would set him on the toilet because sometimes it took him a little while to relax. And so I would say, ready, aim, and then I would say, fire, and then I would start to sing the song, the disco song, fire. I'm not going to sing. Yeah. But anyway, and do a little dance. And that was, he knew, it was time to let go and go. Which I got to tell you, when we would go out places and be on a different potty, it distracted him from all the different things that were going on, reminded him that, that it was sort of a cue and that he knew to go right then. So we got to it quicker.
Right.
Different things for different kids. But Dr. Kenzer, this has been so wonderful. We so enjoyed it and we learned so much. Thank you so much for joining us. We'll have to have you back again.
Well, absolutely. Thank you so much.